for our May Summit Care as well as Summit Pacific Health Talk. First of all, I really want to acknowledge Maddie, Liliana, and Lisa for the work. And as I told the people who are in the room, they're the ones that actually make me look smarter than I really am. So grateful for that. And so I think as I turn 50, I realized the truth is as we get older, we have more aches and pains, right? And so today we're going to talk a little bit about that, about how we can improve our musculoskeletal health, and go a little bit about aerobic health, because if your heart's not working, your muscles aren't going to be strong. And then on top of it, talk about how we deal with some general aches and pains. Feel free to ask me questions for those who are in the room. Interrupt anytime. And then for those who are watching online, I'll try to remember to repeat the question so that way you can hear. So what we're going to be talking about, and hold on 1 second, I'm going to fix that. This is not working. No, it's still there. Works out. I don't know what happened. Anyways, so what we'll be talking about today, first of all, some general topics about musculoskeletal health. Really focusing in on aerobic fitness, what we need to do there, talking more about strength and flexibility, how we gain those. And then obviously bone strength, right? As we get older, we tend to lose some bone density. So how can we prevent that from happening? And then what happens if we do have an injury, for both acute injuries, and then talk about what if you have a chronic nagging issue, and what's the difference between really acute pain and some chronic pain, and what do we do differently for those? And then finally end it with some red flags of things that you need to be more concerned about if you do have some aches and pains. So first of all, what do we know about screening for exercise? We'll talk a little bit more later about the difference between like moderate intensity and high intensity workouts. But the good news is for most people, in fact, you can start a moderate intensity workout without really out seeking provider or physician advice. Things though that you need to be looking out, if you do have a chronic condition, diabetes, heart disease, things to that extent, then it probably is best to speak to your provider before starting an exercise program. They'll do some general screens depending on your health condition. Sometimes they'll do some additional testings, maybe an EKG, to test for your heart. But generally, most people could start an exercise program. The other thing that you need to watch out for is some people have a family history of somebody who has what you call a sudden cardiac death. You'll see that sometimes in young people who will be playing a sport and suddenly the heart goes into what you call bad rhythm or arrhythmia, and they'll die from that unless they get significant interventions. And so those types of things you also need to talk about with your physician. Good news is, once again, that most people can do an exercise program. We'll talk about those benefits in a moment. The final thing is things also to be worried about when you're starting an exercise program is you begin to develop symptoms, short of breath, lots of dizziness, things to that extent, or chest pain, other cardiac symptoms such as left shoulder pain, not associated with moving your arm, or jaw pain. Those would be potential cardiac symptoms, and you really should kind of stop what you're doing and then talk to your provider before resuming it. Hopefully none of that happens, but those are the things to worry about while you're starting an exercise program. So the reality is God made us to move, and our joints feel better, our muscles feel better when we move on a regular basis. And so physical activity, I'm going to give you a couple of definitions, is body movements that basically increase our energy expenditure, so raise our metabolism beyond what we do at our baseline state. So basically when you're sitting there watching television or not doing much activity whatsoever. Now the difference between exercise and physical activity is physical activity may be considered work. Maybe I'm a landscaper and I'm very active because I'm a landscaper. Where exercise is a planned physical activity specifically used to improve my health, my flexibility, my strength, or something to that extent. And the reality is, even if I have a very physical job, there may be some exercises I need to do. So an example would be, let's say I am that landscaper. and I'm very active. I really don't need to get aerobic conditioning, but maybe I have a muscle imbalance and I'm very shoulder posture forward. I have a lot of back pain. Well, maybe I need to do some stretches, some strengthening of my core muscles, exercise on top of what I'm already doing for my physical activity. Now, aerobic exercise obviously is designed to improve my cardiovascular state, so getting my heart better, my lungs better, decreasing my pulse, which has really been shown to prolong and improve the quality of life. And it's composed to strength and resistance exercises, and that's really bent around gaining muscle strength. And strength and resistance exercises, there's a tiny bit of difference, but for the scope of what we're talking today, we'll kind of combine those into one group. And the reality is aerobic exercise and strength/resistance exercises are both critical for our heart and for our general health. And we really should be doing both of those. So physical activities. In fact, if you look at all the interventions that we do in healthcare, physical activity is one of the best studied to actually show benefits, and also shows one of the least amount of side effects. So if you could do anything for yourself, physical activity is what you need to do. Now, the reality is, despite physical activities, there's genetics, there's bad luck, those other things. So some of us still need medications, but often, in fact, we have somebody in our Summit Care Right program right now who is on very large amounts of insulin, almost 100 units, and is down to about 25 units now from significant weight loss, increasing her activity. And so the goal is to be healthy, right? Sometimes that involves medicines and physical activity. Sometimes it's let's be more active, and maybe I don't have to take as much, or maybe I could stop something there. So we know that sedentary behavior, so that couch potato right there, leads to a lot of bad impacts, right? Obviously, we gain weight, we are at higher risk for premature death. In fact, this Dr. Lee did a study, and he looked at a lot of different factors, and based on what he found, 9% of premature deaths in our country are likely caused by sedentary behavior, meaning people who, if they were more active, they would have been able to live longer. But on top of risk of death, increases the risk for all kinds of things: cardiovascular disease, diabetes, and even cancer. And we actually talk a little bit about some of the cancers that have been shown to decrease the risk by just being active. So, benefits of exercise. Some you obviously know because I said what are the disadvantages of being sedentary, but lower risk of death, and to me, just as important, you improve your quality of life, right? I want to live long, and I want to live really well while I'm living long. I think that's probably the goal for about all of us. But it lowers the risk of cardiovascular disease and death associated there. High cholesterol goes down, blood pressure goes down, and your pulse goes down, meaning your heart works less hard, keeping it going for a longer period of time. Multiple cancers: stomach cancer, colon cancer, breast cancer, colon, kidney, they actually decrease just by being more active. So if you look at all the same factors, genetics, heart disease, your diet, just by being more active, you decrease your risk of cancer. Improves your cognition and decreases your risk of dementia, such as Alzheimer's disease, right? We want to live longer, we want to live better. We don't want to get dementia. Being more active, it's one of the things that we can control. Improves our mood. And it's not just getting outside, and I encourage you right now, days like today, to get outside and enjoy the sun, which helps your moods too. But just by being more active, even in the rainy winter day here, your mood's better and you sleep better as well. Studies all show that. Obviously, obesity and diabetes improves your bone health. As we get older, as I mentioned, you lose bone density with time, and it helps to keep that going. And then we could do more. We can improve physical function, do more work around our house, more fun activities, and then it also decreases our risk of fall. All of this clinically proven by being just more active. So what are the risks? And we talk in medicine about risk and benefits. Risks are very minimal, but obviously if you're more active, my son plays soccer, right? Great activity, he sprained his ankle. It happens, right? So you're at a little bit higher risk for minor tears and pulls and things just by being more active. Jennifer's an athlete, I'm sure you know that specifically. But the truth is, people who do not participate in physical activity, they're actually more likely to be hurt worse. So if I'm active, I'm doing some lifting or carrying or working in my yard, yeah, I may pull a little something, but I get better and I'm fine in a day or two. As opposed to if I'm not as active, then I'm more likely to herniate a disc or cause a much more significant injury. So much better off for musculoskeletal concerns if I am active. The second thing is we talk about arrhythmia and cardiac events. And we do know, as I mentioned before, warning factors if you have a history of a family member with a sudden cardiac event or even death due to a cardiac event. There's increased risk of arrhythmia, in particular for new people who exercise, associated with exercise. But the reality is most people who can train under supervision, so if you do have that risk factor, most people still can train and become more active. But then you want to do it under supervision of a provider or a physical therapist or something to that extent. So long term, from both a cardiac perspective and as musculoskeletal and other health benefits, there's no doubt that exercise far outweighs any potential risk associated with it. So let's move on and talk about the aerobic fitness. And you see this healthy potato there. He's decided to leave the couch, and now he's going and he's being active. So what are the current recommendations? And right now, it's recommended that people get at least 150 minutes of at least moderately strenuous, and I'll define that in a moment, moderate intensity exercise every week. Ideally not doing it all at one sitting and trying to avoid going more than 2 days without getting some level of exercise. Now, I've said this before in a previous talk, the reality is you may have a bad week and you can't get 150 minutes in that week. You're still better doing something than nothing, okay? And so if you have a bad week, that's okay, but try to do the most that you can despite it anyways. And in fact, they've even studied people with diabetes, and what they found is just standing. You know, they're sitting at the desk all day, maybe working on a project that's due, but just even standing for a few minutes, it will lower your blood sugar and has positive impacts on you. So always try to do something. In addition, as I mentioned, and we'll talk more, is to add the resistance exercises, some strengthening, which will help to improve your metabolism and your general health also. So what we define as moderate exercise would be like a brisk walk, mowing the lawn, maybe going up some stairs or something to that extent. I'll talk about a definition of how they measure the pulse, because some people really like that. For most people, though, I like to describe it, because most people, you don't measure your pulse, I know I don't, is you should feel after maybe 10 minutes or so, maybe a little sweaty. You should feel like, I can't sing, but really having a deep conversation's a little bit hard because I'm feeling just a tiny bit, short of breath because I'm going, but not significantly. And that's what we would define as moderate intensity exercise, as opposed to a vigorous exercise. That'd be something like running, a vigorous swim, or kickboxing, something to, I didn't think I could do that, kickboxing or something to that extent as well. If breathing becomes very deep and rapid, right, you really can't feel like you're having much of a conversation at all. I'm definitely not going to sing, and generally you start sweating after only a couple of minutes, and that's when you know when you're really getting to that vigorous exercise. If you're starting an exercise program, start moderate and then work your way up, as opposed to starting at a high intensity. It's just better. You're less likely to get injured, and quite frankly, you're more likely to continue with the program by starting at moderate before moving forward from there. But you can also look at what your heart rate is as well. And so when you calculate your, it's basically you start by calculating your maximum heart rate. So I'm 50 years old, happy birthday to me. And so what you do is you take 220 and you subtract your age. And that's how you determine what your theoretical maximum heart rate is. Reality is that's not actual your maximum heart rate, because everybody's different. But it's a good way to guess what that is if you're doing maximal amount of a vigorous exercise. So if you're 50, that will get you to 170. And then you want to get your heart rate into a particular zone. And so for moderate intensity, that's like 50 to 70% of that. So if you're 50 years old, it'd be between 85 and 119, sort of your goal heart rate if you want moderate exercise. And if you're going to do vigorous exercise, you want to be more in the 70 to 85% range, with a maximum heart rate of about 119 to 145. You could do that calculation, I like to tell people, but the reality is think moderate intensity. I could talk, maybe a little challenging, I get sweaty after 10 minutes, versus vigorous, which is easy. You know, after a couple minutes, I get sweaty and really don't want to have a conversation. Any questions about aerobic exercise?
Kind of.
Please.
After being ill for a long time, I got a job, a very physical job, and I was walking a lot before, but I am so just done by the time I'm done working. I don't have any energy to, you know, get out and walk anymore than that. So, well, I guess what my question is how long after, so I've been working for them for about 4 months, I think. How long should it take me to be able to get used to that kind of a job, to be able to know that, does it make any sense?
No, exactly.
To add exercise to it.
Yeah. So there was a question in our audience about a person who works a fairly physical job, used to do a lot of walking for exercise, and now is so beat by the end of the day that it's difficult, you know, to continue that level of aerobic fitness. And I would say it takes a time. And it's not surprising because there's not even just the physical component of a job like that, there's a mental component too. And it may actually be that mental fatigue even more so than the physical fatigue that is contributing to from a cardiovascular standpoint after work. For many people, it may not be, but for many people, that's the case. A couple recommendations in terms of walking. One is to consider on a break, getting outside, and not for brisk exercise, but a little bit of, you know, spending 10 minutes to walk and back. Because that will do two things. One is you actually get a little bit of exercise in there, but the second thing that it can do is actually help to awaken you a little bit as well. Whether it's sedentary, I know you have to do a lot of standing in your work, by going out a little bit, it may actually make you feel a little more invigorated. Something to consider. Thank you for the question. So strength training. And strength training by definition is progressive overload of muscles. And so what happens is, let's say I'm working out with some weights and dumbbells or something to that extent. Two things happen. The first is over time, my muscles actually get more efficient, meaning they fire more quickly. They can hold on to things a little bit more with just the same amount of muscle mass. Over time, what happens is I progressively overload these muscles. They actually what they call hypertrophy. So energy is used by my body to actually make those muscles stronger in order to keep up with the pressure, this overload that I'm adding to muscles. And that's what happens when you're doing strengthening or resistance exercises. What we know, though, is as we age, we start to get what's called sarcopenia. It's basically a fancy term for muscle wasting, meaning we get weaker as we get older. And that happens with everybody. But the good news is by keeping up with resistance training, we could stop that process for a long period of time. And actually, people who haven't been working out, you know, in their 80s and 90s can actually gain more muscle strength, you know, with a good exercise program. Other benefits, it improves bone density. We'll talk a little bit more about that in a minute. Outside of the cardiovascular benefits, it also decreases people's risk of death. It promotes weight loss, and it also improves our blood sugars. And what we know is a pound of muscle actually burns about 3 times as many calories as a pound of fat. And so one thing I recommend is when people are trying to lose weight is that they do some strengthening exercises as well because their natural inclination when we lose weight, in particular if we lose weight fast, is our metabolism slows. And so by doing additional exercises of strengthening, you help to keep your metabolism up a little bit. And so it's important to add that resistance exercises as well. It decreases cardiovascular risk factors even outside of aerobic activity. And then the other great thing is it decreases risk of progression of osteoarthritis and pain associated with it, because basically strong muscles promote joint health by protecting the joints, and you're moving the joints once again. And a lot of people, when they have osteoarthritis, one of the things they mention is they're very stiff in the morning. But as you move, those joints loosen up, and so keeping that movement, strengthening around, really helps specifically. So I do have a hand up for the people in the room, and this is on the screen, just to show you a couple exercises that most people can do when they're starting an exercise program. Resistance, because some people think you have to use weights, but really gravity is a great weight. And one are basically what we call heel lifts. And ideally you get up, work up to getting 12 sets, or 3 sets of 12 of these. Basically you could use something to balance yourself. If your balance is not great, use to get up on your heels. A great way to add a low weight is a water bottle. Most water bottles weigh about a pound. And so that's the cheapest way you can to get pound dumbbells is to get a couple of water bottles specifically. A great exercise for your back if you really want to strengthen your back and want your posture basically grows. One way to do this is you lean forward a little bit, not to the point where your back really hurts if you have a bad back, and then just pull forward with the bottle. Great way to add strengthening and improve back health. Crunches, a lot of people talk about sit-ups. Sit-ups can be kind of hard on the spine as opposed to a crunch, where you're really just lifting yourself up just to your shoulder blades are off, basically off whatever you're lying on, the mat or whatever. Obviously, you could do leg extensions, working on your quadricep muscles. Wall push-ups are a great way for pectoral strength, and so you're leaning against the wall, and you just push it up, right? Obviously, you could work well to regular push-ups, but the wall push-ups are a great way when you're starting. And depending on how much you're leaning into it, you could actually increase. Lean more into the wall at a greater angle, you're actually going to increase the amount of resistance that you push through. And then obviously you can kind of do your work on your shoulders or deadlifts using a water bottle or something to that extent. And so those are just some great exercises that most people can do at home without significant equipment. Flexibility. So besides muscle strength, remaining flexible also protects your joints and prevents injuries. Lots of benefits associated with your flexibility, overall health, lower healthcare expenditure because you're less likely to strain a back or a quadricep or hamstring. Fewer mobility limitations. As we get older, we become stiffer, and so by maintaining that flexibility, we could generally do more. And then obviously decreases our risk of pain as well as injury by remaining more flexible. Generally, it's preferred after a warm-up, so if you do a little bit of walking and then stretch. But what I always say is, let's say you don't have time to do the walking, but you have time to do a few stretches, still do your few stretches. There's a perfect world and there's a reality world that we live in. And it's okay if you can't do a little bit of warm-up, still do your stretches. When you do a stretch, and this is really important, because I talk to a lot of people about stretching. So let's say I was going to stretch my hamstrings. That's a muscle in the back of your thigh. And let's say I was going to do it while standing. What happens when you stretch is a couple things. The first is how long do you hold the stretch? A lot of physical therapists will tell you about 30 seconds. The reality is when I stretch, I count fast. And so I always tell people 60 seconds. Because I know at least get 30 seconds, because when I'm stretching, I'm good, when I'm going to be done. When you're leaning forward and starting that stretch, you should feel a pull, but it should not be a significant pain. A stretch itself, if you're really stretching, should be a little uncomfortable, but not, oh my goodness, what did I just do to myself kind of discomfort, right? Then you know you've done something wrong, you're stretching incorrectly, or you hurt yourself. As you stretch, that muscle will start to relax. And as it starts to relax, you can actually get into the stretch a little bit more. And that's when you really begin to basically lengthen that muscle and gain flexibility. And most people will say you should stretch at least twice a week. I really think if you can, stretching every day. Well, I'll show you some stretches in a moment. I think hamstrings are probably the best muscle, and at least ones that sometimes we do to stretch because it protects your back, your spine, it protects your legs as well. So I encourage people to stretch every single day, and then also stretch before you can do any significant strenuous activity. If you need, let's say you need to go out and do a lot of yard work, and maybe have a little bit of bad back. Stretch before and stretch after, and I guarantee you it will pay off the time that you're taking the stretching because you're less likely to get hurt. And that's actually something you could do before if you're doing physical work to do preemptively, and then take the time during breaks as well. So here's a few stretches specifically. Here's one just for your back. You're basically sitting and you're leaning forward. It feels really good across your low back. Second one is for your calves. Basically squeezing against the wall, you're leaning forward, and then you feel it right through the back of your calf. Great one for your quadriceps, just up like this. Once again, holding it 60 seconds. Hamstrings, I showed you one just with a chair. If your balance isn't good, one thing you can do is use a long towel, like a beach towel or a blanket, and pull back that way. When you do it, though, you want to make sure your pelvis is flat against the table or your bed or whatever you're stretching on. This is a great one here for your pecs. And what we find in this computer-based world is we're forward like this all day long. And so a lot of people get pain in their interscapular area between the shoulder blades and that kind of upper portion of your back. And so a great stretch for that is you grab a wall, or you can even be in between a door frame, and you're leaning into it. And it's a great stretch right across your chest, just relieves that pressure. And really encourage people, if you're doing physical work, trying whenever you got a moment to get the stretches in, because it'll make you feel better as the day progresses. And then this is a great one also for the back, because once again, we're forward all the time, and you're leaning forward, get up on your hands, and pushing yourself back. Once again, trying to keep your pelvis flat on the ground as well when you're doing that stretch. Questions about stretching? So bone health. As we get older, what happens is we begin to lose bone density. And so for most people, sometime in our 30s, we reach our peak bone density. So basically when our bones are strongest. And then we start to lose bone health from there. Women are at bigger risk for what we call osteoporosis or weaker bones. But men can get that too, okay? And so what happens is most people, once they reach a peak, in particular in women where this is better studied, lose a little bit of our bone strength a year, 0.4%, 0.4%, which doesn't sound like a lot, but over the course of time, that adds up. And then, in particular, in that kind of perimenopause area, bone loss in women actually quickens. And women could lose over 1% of their bone strength a year. I know it's not fair, but that's just, it's not fair, right? But that's unfortunately what it is. Men tend to maintain their bone strength better, maybe it's testosterone. I'm sure somebody studies it, but I don't know exactly why. In particular, that happens in our hips and your spines, and that's why women in particular, but it can happen to men, are at risk for hip fractures when they get older, and that's a bad thing. You don't want to have that taken. So what can you do to decrease your risk of getting osteoporosis or weak bones? And the good news is there's some things that you can do. There's genetic factors, there's lots of other factors. It's not perfect, but there are some things you can do. The first is weight-bearing or high-impact exercises. And so those would be things like lifting weights, jumping jacks, burpees, stuff like that, where you're doing, basically putting force through your muscles and through your bones. actually encourages your bones to maintain that strength. And so that's really important to do, in particular if you're a woman, but for men as well. Calcium and vitamin D are very important. Calcium is basically the structure of our bones, so that's most of what our bones are made out of is calcium. And then vitamin D is what allows bone absorption. And what we know in the Pacific Northwest outside of days like today is we don't have much sun exposure, and sun actually promotes us naturally to have more vitamin D. But we're not in the sun as much here, right? And so for many people, in fact, I do this myself in my family, supplementation with some calcium and vitamin D is probably a good thing. There's different recommendations, you can find different, but generally about 800, we call international units of vitamin D, and then about 1,200 milligrams of calcium a day are generally recommended. Some supplementation is better than none. Different sites will show you different numbers, but this is a good general recommendation. On top, okay.
What type of calcium? I used to hear that oyster shell calcium was the best to take, or what is the best to take for us?
And that's a great question. I've seen different things too, and I've heard about that. And I would say probably calcium citrate, I think, is the best. Go ahead, please.
You get that in powder form, and one of the brand names is Calm.
I haven't heard that one.
Yeah.
We're talking about, just so you know, we're talking about different calciums. There's questions about what is the best. I think even if you're doing calcium carbonate, you're going to get some benefit of them. It is the reality. It's good to have it also in your diet outside of supplementation. So like leafy vegetables have a lot of calcium generally as well. Most milk is fortified with vitamin D to help with that calcium absorption. You got to watch with milk, you know, when there's too much of it because there's some calories and other things, depending on what type of milk and fats as well.
The vitamin D, I know you're supposed to take like 800, but the vitamin D is the same as the D3 that's seen out there?
Yeah, there was a question about vitamin D and vitamin D3, and that's a type of vitamin D, yes.
Okay.
That's a good question.
I'm wondering what I'm overdoing here because I haven't taken my vitamins lately, so I'm going to get back on track with those. Because my knees are acting up because I'm not getting it.
Oh, yeah. So, and the good news is a multivitamin, you could look, well, most of them have calcium and vitamin D in it too. Sometimes you'll take some additional as well in particulars. And sometimes providers will have to check what your vitamin D level is. And there's some more intense types, and I won't go into that conversation. So if people's vitamin D level is very low, there's other types of vitamin D that you can use as well. There are different units depending on the type of vitamin D. And I won't go into all of that today, but yeah, dig in and check your vitamin D level specifically. And then for some people, despite what they do, they could be at risk anyways. And in particular, as we get older, sometimes your provider will basically do what's called a DEXA scan, where they look at your bone health. And if there's what's called a T-score. And a T-score is basically, the T starts what the average 30-year-old in your sex bone density is. And we know that we lose bone density. So if it gets below 2.5 or minus 2.5 compared to where it used to be, what they'll do is generally recommend to take medication management for that. And a lot of people work with their own provider if that's an issue. And then if it's lower, it's kind of between minus 1 and minus 2.5, sometimes providers will start on it, depending on risk factors and other things. But something to consider, in particular, if you have a family history of bone loss or hip fractures, those sorts of things, then you do want to talk to your provider about your bone health specifically. And then the final thing you got to think about is fall prevention, right? Because if you do happen to just be, you know, unlucky and genetically you're likely to get osteoporosis, there's certain ethnicities, Scandinavians in particular, are more prone to having osteoporosis. Fall prevention is critical. And there's exercises you can do. Some people like Tai Chi, other things to improve your balance to prevent falls. Because if your bones are weak, you need to prevent falls. So let's talk a little bit about basic sprains and strains. Obviously, you could hurt lots of different joints. You could have all kinds of different fractures and things like that. Not well beyond what we're talking about today. But so basic for strain, I sprain my ankle, I pull a muscle while, carrying something, I hurt my back. It's not, my leg's not numb or anything like that, but I pull it back, it feels really tight. That's what we're talking about here, okay? The general term that we use is RICE. So rest, ice, compression, and elevation after any specific kind of ache or pain, muscle strain, or sprain. And so rest, when we talk about rest, it's relative rest of the joint, it's not bed rest. In fact, it used to be somebody would have a cardiac condition or end up in the hospital, and they would put them on bed rest for 2 weeks. And we thought that was great. What we found is actually it was the worst thing possible for people. Because what happens is we lose cardiovascular strength and we lose muscle strength. And then generally, the rule of thumb is for every day you're in bed, it takes about 2 days to get that strength and that cardiovascular benefit back. And so not talking about bed rest, but resting that joint where you pulled. That may be on crutches, maybe bracing it or something to that extent if I sprain an ankle. So ice. Generally, right after the injury is the best time to ice, and it's about 20 minutes on, 20 minutes off, in particular at first. And what ice does specifically is it decreases blood flow to that area, so you're decreasing inflammatory cells that would come in, and you're also decreasing bruising and swelling, and that really helps long term is to kind of keep that controlled. And so that's why they recommend ice. Look at your skin, obviously, when you're doing so. People can get an ice burn or they can cause damage. So you just want to watch that specifically. So generally what you want to do is wrap whatever whatever you're using for ice in a towel, wet, moist towel or something like that, so it's not directly against your skin. Most important for the first 48 hours, and there's difference in terms of when you can switch to Heath. Some people say 6 weeks. You probably could use it sooner for most injuries there. A great thing that people use, if you don't have anything else, is you take your frozen peas and carrots, like your Forrest Gump, and you toss it on whatever you're using there. It's a great, cheap man's ice bag that you can use as well. So compression is important because it decreases the swelling as well. And so that would be like an ACE wrap. You sprain your ankle, you put an ACE wrap around it, or you hurt a muscle, you put a little bit of an ACE wrap around it. And then you could also long-term even brace something on top of it. Like my son, after he sprained his ankle, he braces it now while playing soccer until after season when he can get strength really back up there and protect the joint. We'll talk a little bit more about that. And then finally, elevation. If you think about it, if you elevate something, it's harder for the blood to get there. It's the exact same reason. You're trying to decrease that acute blood flow into the joint so it doesn't swell up or whatever was injured. Tylenol and anti-inflammatories. Obviously, some people have contraindications to either Tylenol or NSAIDs. NSAIDs, anti-inflammatories, are things like ibuprofen, Aleve, and there's also a bunch of other ones that are prescription. Generally, Tylenol just helps with pain, but it's great if you're hurt. It has something to help with pain. The NSAIDs, non-steroidal anti-inflammatories, will also help with some of the inflammation associated with an injury, and so they can be benefit you, in particular for a few days if you don't have a contraindication to it. Quickly want to regain your range of motion, and that's one of the first things that you work on. So if I hurt my shoulder, I may start by just working on what we call cog-bends, where I just lean forward and I'm moving my shoulder like this. Or if I hurt my ankle, I sprain my ankle, I'm making the alphabet, not putting pressure on it, but I'm making the alphabet with my foot, and my A, my B, and C. So I'm putting my joint to its normal range of motion without a lot of stress. Because what you find is after a muscle sprain or tendon sprain, we tend to lose flexibility. You want to keep that flexibility. And then after you get your flexibility, you begin to work on your strengthening again. Work first with walking, maybe doing a few exercises, and gradually increase from there. And then gradually get back to whatever activity you were doing previously. So chronic pain. So there's a couple things when you think about any joint, whether it be your back, which is a series of joints, your elbow, your knee, or whatnot, or shoulder. And if you think about anything that offloads, takes pressure off a joint, it's going to make it feel better. And then anything that adds pressure to the joint is going to make the pain worse. So the first thing you want to do is gain strength around the joint and flexibility. And that's another reason why we want to gain that, because stronger muscles will support the joint. In fact, if I have back pain, I can improve what's called my core muscles, which are those deep abdominal muscles, and train those to actually fire. So I'm bending over, I proactively fire those muscles. After a while, it becomes second nature, and then I do my lifting, right? Or if I improve my flexibility, what I've done is then basically decrease that muscle pull on the joint as well, which will then decrease the pain. And then also bracing in some instances can help, in particular after an acute injury, less so than a chronic. The thing you have to watch though with bracing, because it does offload a joint, is you can actually make muscles weaker long term, and you can lose some flexibility. So it's probably best for specific activity, and then you stop your brace. Some people will, with a chronic back condition, they have to do lifting, will wear a belt, right? But you don't want to necessarily wear it all the time. I hurt my ankle, chronic ankle pain or knee pain, I know I'm going to go play some soccer. Well, all right, use it with soccer, but probably not use it all the time, because then I could actually cause some weakness specifically. And the final thing is anything that increases pressure on my joint is going to increase my pain. And so obviously, for some people, weight can be an issue. And I'm not saying that weight causes the pain, but it can make it harder and then make you feel worse. But then once again, non-flexibility, muscles are tight, it's going to make it. And the final thing about chronic pain is really focusing on what we call pacing. And so what happens is, let's say somebody likes to jog, and they jog 5 miles a day. Most people consider that person incredibly healthy. Well, they decide, okay, I'm going to go run a marathon tomorrow. Well, I guarantee, first of all, maybe that person won't make the marathon. But let's say somehow they just push through it and they complete the marathon. Amazing, go from 5 miles to over 20 miles. Well, I guarantee you, at a minimum, they're going to feel horrible for about 3 or 4 days. Because their body's not trained, even though they're really healthy, 5 miles a day. I wish I ran 5 miles a day. They're not trained to do the 26 miles. The second thing is, they're likely to, even if they completed it, to hurt themselves somehow. You know, they get plantar fasciitis, they get shin splints, they pull a muscle or something like that. Because once again, they're not trained to do 25, 26 miles. Well, the same thing holds true if, let's say, I've not been active for a very long period of time at all, and suddenly I decide, well, I'm going to walk a mile. Well, maybe 20 years ago, walking a mile wasn't a big deal for me, but now it is. And so it's the same jump from going from a couch potato to walking a mile, maybe, as somebody did 5 miles to running that marathon. And so one thing I recommend for everybody is a good walking program, but start at a level that you feel pretty comfortable in. Maybe it's a little bit of a strain, but it's not too much. And then increase every week by about 10%. And so, I was talking about this before, if I can walk a block comfortably, let's just start walking a block comfortably, that's great. Don't walk 2 blocks the next week. Walk a block plus a house, or 2 houses, something to that extent. Because then you gradually increase. And by starting the small habits, then, and not flaring up too much, you're more likely to continue. But what I see often is people with chronic pain, they go from not doing much to suddenly, you know, their yard's a mess, and they want to weed, and they want to do all this stuff, and having a pretty good day, and they go do it all. And then they pay for it for 3 or 4 days. And I'm guessing many of us, including myself, I've been there before. I pushed it, and then I paid for it, right? And that's the importance of pacing. A little bit at a time. And then once again, when you're really hurting, though, don't stop. Maybe that day, I'm really having a bad day, I'm only going to walk half a block, but I'm still going to do something. Because that continuous activity is better long term. So finally, red flags for joint and muscle pain. So there's some things that you should be aware of and probably speak to a provider if they occur. The first is pain that's worse at night. Sometimes that could be reflected. I don't want to worry people, but in particular when you're trying to sleep and you're not doing much activity. Not saying that you don't wake up with some pain and you roll over, but pain worse at night is generally a little bit of a red flag. Significant redness or inflammation, which could be a sign of infection or cellulitis. So if your joint becomes really red and inflamed, maybe you have an infection in that. Or fevers or chills associated with it, or weight loss. Once again, that could be a sign of an infection or malignancy. Don't want to worry people, but those are just red flags that you need to consider of. If your back hurts and you start to have muscle weakness, not that it hurts to move, but you notice, well, I can't really lift my ankle up as much as I used to be able to do. Or, it's really numb and tingling, it's not moving as well. That's concern of a potential nerve injury associated with your back. You really should be seen for that. If your back bothers you and you lose contents of bowel bladder, that's a medical emergency, and you really should be seen. Go to the hospital, quite frankly, if that occurs. Likely not going to happen, but those are the biggest warning signs. And then if you become significantly symptomatic, shortness of breath, chest pain, things we talked about before with activity, that's also a red flag. Dizziness, your heart feels like it's beating irregularly, those sorts of things are all red flags for joint and muscle pain. So what we talked about today was, number one, just general musculoskeletal fitness and health. Really the importance of aerobic activity, getting at least 150 minutes of aerobic activity spread out throughout the course of the week. Importance of strengthening the flexibility, which improves your bone strength, as well as improves your metabolism, in particular if you're trying to lose weight. And then a little bit about acute injuries, in particular with rice, rest, ice, compression, and then elevation. And then really the importance of pacing, gradually increasing activity if you do have chronic pain. And then just the red flags we just mentioned. Just really want to thank you all for your attention, and we're happy to entertain any more questions. All right, thank you guys so much. I appreciate it. I didn't feel like I did the best job answering these questions.